Hi, Dr. Sandeep and Dr. Bharat. My friend is undergoing lymph node dissection under VATS for lung cancer treatment. Please help me understand this.
Lymph node dissection is a very important component of cancer surgery. Lymph nodes are the filters in the body which can sieve out or they filter out the cancer cells and store in them before they spread to rest of the body. So it becomes very important to remove them when we perform surgery in order to get a lasting long cure. Now, it is done in all forms of surgery, whether we perform an open surgery, whether we perform minimally invasive or video assisted thoracoscopic surgery or VATS, or for that matter robotic surgery. Now, is there any difference in the way it is performed when it is VATS or any other minimally invasive? No. It may be easier to perform with less amount of trauma, but the same surgery is performed whether it is open, laparoscopic, thoracoscopic, VATS or robotic. All the destination or the final result of the surgery is expected to be same. So when we perform a surgery, lymph node dissection is always performed. And what we call as a systematic lymph node dissection means there are specific regions of lymph nodes which have to be removed for a specific cancer. So for one lobe of the lung, there are many lobes in the lung, there are totally 5 lobes in the lung, 3 in the right side and 2 in the left side. So each of these lobes have a specific lymph nodes to be removed in order to get a good result. And all these lymph nodes which are relevant are removed when we perform any of lung cancer surgeries.
So mediastinum is the central portion of the chest wherein the heart and the airways are located. So the lymph nodes are located in this portion along the airways and along the main blood vessels which supply the body. Any cancer after affecting the particular organ then goes to the draining lymph nodes. So it is always important to address the draining lymph nodes. So in lung cancer, the tumor usually drains to the mediastinal lymph nodes. So it is very important to address these nodes. There are two parts to lung cancer surgery. One is removal of the tumor along with a good margin. The other is removal of the lymph nodes. As I already told you that the tumor first spreads to the lymph nodes before going elsewhere. So it is very important to address the lymph nodes. So the mediastinal nodes can be addressed via a lymph node sampling or a lymph node clearance. So there have been few trials which have been done which shows the superiority of mediastinal lymph node dissection compared to lymph node sampling, and systematic mediastinal lymph node dissection is the standard of care. So basically these nodes are located in the central portion of the chest. It is very important that an adequate lymph node dissection is done for all lung cancers.